Okay, well, let's go. Who goes first? Which table wants to go first? Any volunteers? Okay, let's go. Table two, yeah.
Good morning, thank you. So I just wanted to go first because I'm absolutely certain that some other table is going to have the same question. So we're really struck with the tension between the cost of training students on new technology is a barrier to implementation, and by the time our students complete their programs, those same tools will probably be obsolete. So are we teaching about those, so how do we resolve that tension, right? So we're introducing technology that is going to be changing by the time they even complete the program. And so how do we address that?
I can take a stab at it. So again, from my perspective, it's not the technology that we're teaching, right? We're using the technology to teach. And so in my world, I have to have a complete, pro forma as to why I'm making this investment. So if I'm teaching globally, which I think is probably a little different than just, not just, but, an academic center as an example, I'm teaching people around the world. And so for me to send trained people around the world to do it in person, it's that in itself is cost prohibitive. So there's that aspect of it, right? The other thing that I often talk about with my team, and in fact, when I stepped into the role that I'm in, every country around the world was creating the same content on the same topic and delivering it. And so kind of standardizing that curriculum globally, getting buy-in is a huge one on that because everybody's curriculum is better than the next guy's. And so there's a lot of collaboration that has to take place, and especially in the business world, putting people to rest so that they're not concerned about their jobs and all of that kind of good stuff. But it allows people then to go and create new content or train on new things that they hadn't been able to do before, which then expands it for the rest of the world as well. So I think that there's fairly simple business models that I've used, because I'm not all that bright, in order to be able to justify embracing the new technology from that perspective. Hopefully that helps.
I'm not sure this is addressing what you're asking because just like Cynthia said, in the teaching and learning, we're integrating technology in K-12. We're teaching not the use of the technology. In fact, the kids could be teaching the teachers how to do that. But we're teaching general principles. So in the United States, we have this Common Core state standards. And the Common Core is a set of principles for that content area. So we have learning trajectories, so to speak, and that's specific learning milestones. So the focus is supposed to be on that, not on the technology. And how can the technology make it so that students can master that content along the way? And aligning the affordances of that technology with the goals of the learning, that's the holy grail right there.
So to use a cliche, the students are learning to learn throughout their life.
I have a question for Cynthia. My name is Brenda Zeeler from the University of Washington. Thank you both for your presentations also. Cynthia, and training folks at 12 at a time to insert a pacemaker or whatever the intervention is. One question we had was around the competency of that. So are you how much are you training just like, well, here's how you would do it, but a lot of the device companies, once the institution purchases the device, they send a technician in to actually help in the procedure.
Sure.
And so in this world of being really fearful of see one, do one, teach one, or you're doing this training, but are technicians still going in to help? And how would we evaluate the competency of somebody that was with one of 11 other people that saw this demonstration?
Yeah, so from a part of it that I kind of left out up there just because I was focusing on the simulation technology itself. what they're seeing, 12 people are seeing it, but each one individually is getting on the simulator, right? And learning from that perspective. The whole program that we have in place uses blended learning. So that's what we were talking a little bit about here. So the physician themselves will go on and do a 4-hour learning module. So getting them to do that, I initially thought that would be a huge challenge. So again, using technology and making interactive videos and peer-to-peer, completely non-promotional, they do it. Out of 2,000 physicians that we've trained, only one has said, I'm not doing that. And then he actually did do it and liked it. But doing that level of training and then really taking advantage of their limited time. So if you're able to standardize that, then they don't need to come to an in-person training program as long. These simulators were developed specifically for this procedure, and we did it in collaboration with physicians. So when they actually are holding on to the delivery catheter, they can feel the heart beating, they can feel the tug. I mean, it's very real, and that was the intent of it. And that's kind of where my comment about you can't just have a generic simulator. It really needs to be with that particular procedure. So they're training on that. Some physicians will go through as well and do cadavers and pig models and things like that. But the simulators actually can replace all of that. We are equally training our employees the same way so that they can do exactly what you just described, go in and support the case. But we don't want the first case to be on a human. Yeah.
So just to follow up on that, Cynthia,
Yeah.
I understand what you're doing, but I don't understand how you're assessing competency. So that, I mean, that is important, at least to the old-fashioned amongst us.
Sure, sure.
And it seems to me that you need some system by which you evaluate the competency of each and every fellow or physician or whoever is going to be putting these pacemakers in, that they actually can do it. So do you have an assessment component to your program?
Yeah, so, and that with industry becomes complicated because industry doesn't credential, right? And, it's one of those things actually that when you go through approval that you are discussing with FDA. So we're telling FDA, this is what we're going to do. We have prerequisites the physician has to have, basic skills, before they can even go to the program. And then when they're going through it, as far as assessing their competencies, obviously it really is kind of a pass-fail type of a thing. If you complete the work and you attend the course, their peers are there teaching them as well. So it's kind of that collaborative. But I hesitate to say that if someone did not, in other words, they did the simulator and every single time the patient died, that's when you get into a very difficult. Fortunately, we've never gotten there. But since we're not credentialing, it really is up to the hospital then to decide, kind of the next level, which then goes to what we consider like the phase 2 or phase 3, and kind of that repeatable training. That's kind of the key for us. What are we doing that's repeatable every single time, so that we're sure that what we're providing as far as those skills helps them have the same outcomes as what did the clinical study. But that's a tough one.
Okay, so our discussion sort of focused on the faculty development piece and recognizing that, there are teacher preparation programs for K through 12 that hopefully are learning some of these new techniques, but faculty in higher education, or perhaps those that deliver continuing professional development, don't really spend, they're there by virtue of their content knowledge and not necessarily investing a lot in the teaching. So our question is, how do we help faculty learn the new roles as well as the competencies for maximizing the use of technology in effective ways?
Well, I can take a stab at that. It would be a huge, long answer, so I'm going to not, go there. But the first problem is the incentives for the teacher, for professors to actually need to be good at teaching. They're not incentivized to be good at teaching. They're like you said, being hired for their content knowledge. So how to get them to want to be good at teaching and to care about teaching as part of the work they do, I think that's its own very long discussion. I think that the technology we're talking about right here can be used to help teach teachers how to integrate technology effectively for teaching and learning. To hook people, you need to make the connection between, and this sounds like a no-dust statement, but it goes over a lot of people's heads, that how you teach is directly related to how that person is going to learn. There's a lot of K-12 teachers haven't made that connection. So if the demonstration that teaching methods, pedagogy actually matters, and talking about how humans learn is a strong way to do that. There's a great set of resources out there by Clark and Mayer, and it's called The Science of E-Learning. And what they do, if they've taken cognitive learning science and the principles of cognitive science, and they have written out what that means for you as a teacher in an e-learning environment. So I'm going to just give you one piece of that. They talk about dual channel learning theory, and that we as human beings learn way better when we engage all our perceptive systems than if we're just engaging one. So when we use video that shows visual stimulation as well as audio stimulation, that we learn better that way. And with augmented reality, you have the haptics, so you're holding things. So now you've got that sensory input. So how do we get people to be better teachers is a semester-long answer. But I think if we use the technology in the way that I was just talking about, good teachers integrating technology in a way that aligns with how students learn, that's how we teach teachers to do this. And in the education departments, they're starting to pick up on this. Higher ed can learn a lot from K-12 in that way, but K-12 teachers are incentivized to teach well because their jobs are being cut by their student test scores. That's where that incentive is coming. And when the Obama administration was in place, that was starting to come down the pike for higher ed. I don't know that that's going to be the case at this point. But what students are leaving with, what they know and are able to do, professors were going to start being evaluated by that. That's how K-12 teachers are evaluated, and that's why they care so much about pedagogy. I don't know how to get higher ed to that place. Did you have anything to add? No.
Hi, this is Kathy McGuinn from the American Association of the Colleges of Nursing. Thank you again for those two terrific presentations. This kind of builds on what the first table Brenda and her colleagues were talking about. But Cynthia, we were very interested in your simulation, and we thought it was terrific, and we had some of the other questions that they had. But our question is, do you envision having any interprofessional simulations or expanding to that level? Because we here at the Global Forum are very into interprofessional. I noticed that you come from a medical foundation company, and I understand that, and it is physician-centric at this point. But do you have any hopes or plans to expand?
We have hopes. Probably didn't need to turn the microphone on for that. We do. Yeah. It's something that we do talk about a lot because of the way the patients are being treated, obviously. A multidisciplinary approach to patient care. And so pulling that all together, we recognize that's important. But we're not there yet.
Okay, thank you.
Just to follow up on that, I mean, most of the care that's delivered, and the example that you used of implanting a pacemaker, isn't done by one person. It's done by a team. Mm-hmm. And procedures of all sorts are more and more team dependent, yep. But broader than just procedurally being team dependent. The delivery of care is increasingly team dependent. So I think it's an important issue, and you have the opportunity with the tools that you've developed to actually train teams, which I think would be a lot more effective than just training physicians.
You know, some procedures require that we train teams. I think your question is probably a little bit more broad, if I understood you correctly. But one of the newer devices in the structural heart arena, transcatheter valves, again, where you're going through the groin to place a valve, that is a team approach. And the cardiac surgeon, the interventional, the allied professionals, everybody has to be trained in the room in order to be able to do that particular case. Yeah.
Thank you. Please.
So we have a difficult question, and maybe we can have it answered from both sides. I'm Joanna Kane from the American Board of OBGYN. We were ruminating on the fact that for-profit companies have access to funds to develop these kinds of simulation, which is difficult for traditional professional medical education. So we were wondering, what's the case or the opportunity for traditional medical professional education to partner with for-profit companies to develop cost-effective simulation that might be more foundational, not necessarily product-oriented, but more foundational?
So we actually had that conversation a little bit yesterday as well, and I don't know, look at it's a long answer. Again, I do believe that there is opportunity. When you are working specifically with the business unit, and we're under the watchful eye of our federal government, we have to be very careful about what we're investing in as far as the simulation. And we have, it needs to be tied directly to products and therapies and disease states. So when you get a little bit more general, then you're moving into more of a grant, type of an arrangement where we would provide an educational or a charitable grant, either through a grants and donations function or our foundation, for that type of work. I think where there lies a great opportunity is when the societies and organizations like this can work with industry and taking advantage of both of their areas of expertise. That's another challenge that I think probably many of you that are members of your professional societies recognize. And that's one of those things that I think that we all need to talk about and get past, because there is great educational opportunities when we do work together. Yeah.
Thank you, Cindy. We have time only for one last question. Sorry about that.
We were interested in the competency issue at this table, and since the one has been answered, from a K through 12, how are you putting the emphasis, like, for example, we've talked here about, you mentioned that a child that might not be reading would still be able to learn. So where we're making up for people who can't read and can't write very well, so how do you ensure the competencies at that level if it's learner-centered and allowing a student to learn, and how are they demonstrating the learning and demonstrating something that they need to have later?
So the buzzword is competency-based learning, and somebody mentioned micro-credentials earlier today. That's a real fad right now, and it's only as good as the micro-credentials themselves. But the key is that you have to know what that competency looks like. So kind of aligned with your question, the combination of expertise, asking teachers, asking the learners, getting information from a good variety of informants, we'll say, about what kinds of competencies are needed to master this content. And in some fields, we're really good at that. We know in math, in K-12 math, we're really good at that. We're even better at it in reading. We're horrible at it in science. Not horrible. We're not up to speed yet in science. We're not up to speed at all in the arts. So in some content areas, we've mapped out what they call learning trajectories. And those learning trajectories have competencies along the way. What do you have to know and be able to do in order to move forward? And you have to know that from a content standpoint, a learning science standpoint, the development of the learner, especially in K-12. Children's brains aren't ready to do certain things at certain developmental stages. what's a cool thing going on in this competency-based learning aspect in K-12 is the idea of getting past what do you need to know as a sixth grader to what do you need to know to get through algebra, for example. And you may be doing algebra in fourth grade, you may be doing it in 10th grade. And that's what matters more, that almost that old idea of the one-room schoolhouse, where every kid was learning their own content at their pace, and once they got past that and mastered it, then they move on. So you have to define the knowledge, skills, and abilities, they call them the KSAs. You have to define those as what needs to be mastered for that particular skill set in order to move on to the next one. And then developing the assessments of that, that's really hard.
You also mentioned it being measured by the test taking.
Unfortunately, yes.
Yes, well, that's why I was using that, fortunately.
Yes.
Because, again, that would depend on whether or not they have the skill, if
Yes.
you will, or the ability to have been taught how to do testing, and then whether or not you really consider the test valuable, which comes back again, perhaps, to the reading.
Thank you. I'm afraid we have to continue this conversation at lunch. Let's give our presenters a hand here.